Welcome, everyone. I'm Cynthia Resendez, Marketing Manager at Avenue 360. We're joined by some of our mental health providers who see patients at our Houston clinics or through a virtual visit. Today, we will be discussing what mental health is, what it looks like, and how we can take steps to break the stigma. I'd like everyone to go around and please introduce yourself briefly before we jump into our discussion for today. Ebony, go ahead and get started.
Absolutely. My name is Ebony Scott, and I'm a licensed professional counselor and a clinical therapist here at Avenue 360.
Sandra.
Hi, everyone. Thanks for watching this video and joining us. My name is Sandra Smith. I am the Recovery Support Services Clinical Manager here at Avenue 360, and I am a licensed chemical dependency counselor.
Misty.
Good afternoon, everyone. I'm Samisty Utley. I'm a licensed clinical social worker, and I'm a clinical therapist here at Avenue 360.
Dr. Lee.
Hello, I'm Dr. Rachel Lee. I'm a clinical psychologist, and I see children and adults at the Heights and Memorial locations.
Dr. Wen.
Hi, my name is Dr. Elizabeth Nguyen. I am a board-certified psychiatrist. I am currently the interim medical director of behavioral health at Avenue 360.
Great. So let's get started with the conversation for today. So we'll get started with you, Dr. Lee. So if you can just start by addressing what mental health is and how prevalent it is in our community.
So mental and behavioral health is really a broad term that we use to refer to our emotional, our psychological, and social well-being. It encompasses how we function in our day-to-day lives. Do we feel adequately supported by our social circles? How do we handle stress? Are we able to make good choices in our daily lives? These can be affected by many, many things, including our genetics, our hormones, brain chemistry, experiences in our lives like loss, rejection, or trauma, and things that we've learned in our environment from the people around us. Nationally, about 1 in 5 adults each year live with mental illness. Texas is actually doing a little bit better, though 1 in 6 Texans are living with mental illness, according to 2021 data. Texas also has the lowest prevalence rate for substance use disorders at 1 in 16 adults, and the 3rd lowest rate of suicidal ideation in 1 in 27. Although, as you noticed, even those are quite high. Among youth with depression and emotional disturbance, Texas actually falls a little bit closer to the middle of the pack. About 1 in 5 youth aged 16 to 18 suffer with mental illness.
Thank you. Ebony, so can you tell us a little bit about mental illness? Does it look different? Does it affect women and men differently? And how serious is the lack of treatment and care for those with mental illness?
Okay, so just kind of to address some of the research that's out there as far as the difference between mental health issue and women and men. Sometimes women are a lot more expressive and so a lot more likely to be diagnosed than our male counterparts. And with that, just the higher rate would be because there are more women that are reporting earlier because they communicate a little bit differently. Also, just to address male symptoms, sometimes they show up differently and they may look like, for instance, with depression, for a male, it may come off with aggression or like self-medicating or irritability, as opposed to what people think the common symptoms for depression are, like crying or like those types of other instabilities. And so definitely they present differently in men and women, according to research. And so men being more cognizant of the ways that they present would be helpful in our community, helping to resolve the issue and getting to it before it gets to the point. Generally, men get help after a suicidal ideation or attempt. And so like, it's more likely that theirs will be further along than in women because of that. And so the severity of their symptoms are ones that are more difficult to address. And so, yes, there is a difference. And as for us, solving some of the problems around stigma and like reporting could be helpful, and let's just getting in front of it and helping out with it and supporting.
Thank you. Dr. Wen, can you tell us a little bit about psychiatry, what it is, and how is it different from going to a therapist?
Okay, so according to the American Psychiatric Association, psychiatry is a branch of medicine that deals with the diagnosis, treatment, prevention of emotional, behavioral disorders. And so a psychiatrist, the training for psychiatrists, they're medical doctors that have a degree in a degree as an MD or DO. And they have completed 4 years of college, 4 years of medical school, and they have specialized training in psychiatry. And so some of the similarities would be that they can also do therapy, similar to a therapist. In addition, after diagnosing mental disorders, psychiatrists can also prescribe medications. So, they prescribe medications that target disorders such as depression, anxiety, schizophrenia, bipolar. There's other disorders like OCD. There is generalized anxiety disorder. There's substance abuse that we also can help treat along with therapists and other providers. And after the 4 years of residency, usually therapists, they can go out and practice, or they can pursue further education in fellowship. For example, addiction psychiatry, geriatric psychiatry, child and adolescent psychiatry, forensic psychiatry.
Do you find that there's more stigma about going to a going to a psychiatrist than going to a therapist, per se?
I don't know about the data nowadays about the stigma, but I think from my experience working in psychiatry for the past 10 years or so, I've seen there's more mental health awareness. I feel like there are some population that may still have stigma, but the more that people talk about it, the more that people minimize any stereotypes, or the more that people correct misconceptions and educate, learn more about mental illness, I do find that there's a lot of people that are more open to seeking help. So they may seek help with therapy, they may seek help with psychiatrists. I think either or would be good. If they seek help through a psychiatrist, then when therapy is needed, we do refer patients to therapy. And I've seen a lot of times that therapists, they may see patients first, and if they feel like there's a need, they refer to psychiatry. So therapy, psychiatry, we work together to treat patients.
Thank you. So Misty, this kind of goes with the question I just asked Dr. Wen. So oftentimes in communities of color, there's a stigma about going to a therapist or a psychiatrist. So you could hear something like, oh, you're feeling sad, just go out, read a book, have a nice dinner. How do we take steps in breaking that stigma surrounding mental health?
Sure. Well, I think the first thing is keeping in mind that those things are good. They're not bad things necessarily. However, good intention doesn't always meet the needs of the patient in that case. And so in terms of breaking down the stigma, I think there's, as Dr. Wen had mentioned, a lot of that is just coming from lack of awareness and knowledge. And so to this, I think there's a few steps in terms of breaking down our own kind of self-stigma that may be hiding within our own ideas of what is mental health. So gaining more awareness of how any past views of like mental health, both culturally, societally, familial beliefs around that can help impact our current and future behaviors and beliefs towards mental health of our own and others, as well as getting education from amazing resources. I always think to NAMI, that has a lot of factual, really, really great resources for both professionals and individuals. Also being cautious around language. So one term that we now use is using person first language. So describing a person with a mental illness rather than a depressed person or an OCD person. And with that, often I point to people to label behaviors rather than mental illnesses. So in many cases, someone might not be diagnosed with, we'll say OCD, but they're very meticulous in how they do things. It's not in a disordered way. It's just kind of how that person works. So in those cases, encouraging people to say, well, that's a very meticulous person rather than, well, he's so OCD. To not impact the people who are living with the diagnosis of obsessive compulsive disorder. Also openly talking about mental health, because it's such a wide spectrum, where I think most, well, I won't say most, a lot of people often think if I'm not to this level of depression or to, you know, it's not that bad, it's not impacting everything. We often lose those earlier signs of mental health decline. And so by being more open with those conversations of what does mild depression look like, as Ebony was pointing out, for men, what does it look like for women? And how do we know when we're starting to shift in a way that we might need more support? Lastly, a little bit of advocacy and I think we have been getting more education around this and the impact of our mental health being equal to and just as important as our physical health. So ensuring that insurances and having advocacy that there is coverage for mental health, as well as facilities for those who are underinsured or uninsured to be able to access care as well. And so those are some good starting points, lots more, but just to keep it short and sweet.
Thank you. So Ebony, so in Harris County, there has been an increased number of diagnoses regarding anxiety and depression. So why do you think this is, and what are some of the symptoms that people can identify before they reach out to help, so they can reach out to help at that time?
Absolutely. So in the populations that I've been seeing, I've noticed either exacerbation of symptoms or contributing stress factors, such as housing issues, issues with transportation, inflation, still unemployment, and on the heels of COVID and the height of the pandemic, increased anxiety levels, depressive symptoms, feeling trapped, and not wanting to or not being able to access those resources because they are inside, because we haven't been socially as interactive as we would. Some of the physical activity that we would have maintained has been different. So all of these contributing factors play a role in reintegrating or having barriers to reintegrating into healthy habits. And so those are some of the contributing factors, but us offering the services that we offer in a way that's accessible to patients at all levels. I've noticed that patients are more readily available for virtual services now. And so that we offer that here at the clinic, whether it's virtual therapy or psychiatry or PCP services. And so those are all like ways that we can help with this, but also community involvement. Community entities are now more willing to offer in-person and virtual options for people to play a part in just raising awareness and knowledge and education of what is available for patients to connect. That helps, because really in COVID, some people got trapped in not speaking out and not reaching out. And with mental health issue, there was already stigma. And so those things have kind of created barriers, but I think that since we are progressive in the way that we address them here at Avenue 360, we've been able to get in front of it. And so we've connected with a lot of patients through the pandemic and after. And so some of those things have been able to be resolved as far as psychiatry, therapy, working together, our case management resources, and also our primary care physicians.
Thank you. So something else that COVID also shed a light on was substance use. So Sandra, this has been a topic of discussion during COVID-19 and still at this time. So how is Avenue 360 supporting those that are experiencing a substance use disorder?
Thank you so much for asking, Cynthia. Yes, we have all by now heard the research and the reports of substance use surging in prevalence across our nation, across the world. And, you know, during times of great uncertainty, it is a common occurrence for substance use to increase. And here at Avenue 360, we have met that every step of the way with providing recovery support resources and substance use treatment in person and via telehealth. In discussion about changing and addressing the negative stigma that keeps people from accessing substance use and mental health treatment, we have to address the fact that substance use disorder, like mental health disorders, here at Avenue 360 are treated as health conditions, not as any moral failings, but as what they truly are, mental health conditions that you can recover from. So at Avenue 360, in response to the surging substance use in our community and across our nation, we have enacted a screening protocol so that all of our patients will know that at Avenue 360, you can access recovery from the safety and privacy of your doctor's office. And that is crucial for smashing stigma. We need to have recovery and mental health accessible in all of the different places that members of our community interact. And Avenue 360 is a valued one here in our community. So we have expanded our capacity to support our patients, whether their goal be to reduce their use, to stop using, to look into helpful medications that may support their recovery, to go to peer support groups and treatment support groups. There's a menu of different options that people can engage in based off of their goal, and it's all done in a safe and judgment-free environment. So we are thrilled that the patients at Avenue 360 have this readily accessible path to recovery right here in their doctor's office that is so trusted and valued in their lives.
Thank you. You gave us a great recap.
Thanks.
No problem. So Dr. Lee, statistics show that Texas ranks last nationally for access to mental care. There are many individuals waiting months to get an appointment or access that service. Why do you think this continues to be a challenge?
So I'll start off by saying that access to mental health care is not just a local problem or a state problem or even a national problem. It's an international crisis. Even in the areas with the highest mental health specialist to population ratio will tell you that they do not have enough care options to meet their needs. And that's because those professionals end up supporting the surrounding areas as well. Here in Harris County, we have about 920 residents to every one mental health provider, which is not a great ratio given the prevalence of mental health issues that I talked about earlier. However, our neighbors to the north in Montgomery County only have one provider for every 1,380 residents, and our neighbors to the west in Fort Bend County only have about one for every 1,570 residents. That means that people in those counties are often either traveling long distance for care or not receiving adequate care, which is unfortunately more common. And limited access to mental health services is really multifactorial. There are often financial barriers for patients when insurance fails to cover the service, which has historically been an issue, or individuals that do not have insurance and can't afford to pay out-of-pocket costs. But also when there is inadequate reimbursement for mental health services by government and private insurance plans, fewer individuals choose mental health specialties in school or only choose to take patients that can afford to pay out of pocket, which I can say is a very small percentage of the population. And of course, rural and poor areas typically have a harder time recruiting professionals to support their areas. And finally, as we talked about earlier, the prevalence of mental illness has been on the rise for a long time, and it's not showing any signs of decreasing. Training programs, which typically rely in part, at least, to state and federal support for their students, aren't growing at a rate substantial enough to support the need. And that's really where getting involved in your community, being active as far as addressing political processes that make it easier for people to be able to afford mental health care and supporting that, training and opening up those training opportunities and really getting in and recruiting early, and making sure that, professionals are getting paid for their services, from insurance companies and so on, are all really important things for increasing care. But also, as far as, specialists being in one area of the country and less so in others, the one good thing about the pandemic this past year is that we've managed to really ramp up telehealth across the country. And that's done a very big job in bringing us closer together, and even across state lines. For a while, we were able to support people in various areas of the country that could not receive services. And so that's an area where our specialty has really grown substantially and within the last couple of years. And I think that will really help into the future as well.
Thank you. So this question kind of goes with Dr. Lee was just speaking about. So how does Avenue 360, what options does Avenue 360 have for those who are uninsured or underinsured when it comes to accessing mental health care?
So Avenue 360 does take a number of different insurance coverages. However, as we've noted, sometimes that's not sufficient for care. So if you are underinsured or uninsured, Avenue 360 does provide care based on a sliding scale fee that is calculated by income and household size. So working with one of our eligibility specialists is key in determining what the cost of your services may be with Avenue 360.
Thank you. And when should a person reach out for help?
For sure. I think there's never a wrong time to reach out for help. But some major moments to keep in mind are if someone's having thoughts, emotions, behaviors that are out of control, especially if they're affecting your relationship, your work, or your sense of well-being. If you're struggling to deal with a particularly painful life challenge, like a major illness, the loss of a loved one, divorce, job struggles, if the use of alcohol or drugs is interfering with your health, your emotions, relationships, again, job, if you are confused or fraught between different things that are going on in your life and need perspective from an unbiased party, and especially if you are in a space to where you feel like life is no longer worth living, you're hopeless, you've reached the end of the line, please seek out for support in that case, in maybe emergency services, but also for continued care. Those are just a few of the many reasons someone should seek out support.
Thank you. So this actually concludes our discussion. I want to thank each of you for joining us today. If you have any questions about our behavioral health services, please visit avenue360.org or call 713-426-0027. Thank you.